Americans are literally dying for healthcare. They're dying while they wait for it, and they're dying because they can't afford it.
We talk about healthcare a lot because we are still shocked by how much better and cheaper it is in Ecuador and so many other countries.
People from the United States have been going abroad for decades to get healthcare. If not for the ridiculous American healthcare system, the whole entire medical tourism industry might not even exist.
And we're not just talking about cosmetic, we're talking about necessary medical and dental procedures.
After we talk about just how bad it has gotten, we're going to give you an alternative that will allow you to get the care that you need without breaking the bank.
But first, if you are sick of paying way too much for far too little, then hit that subscribe button because we share cheaper and better alternatives that you may not have even thought about.
The U.S. healthcare system is on fire, but not in a good way.
The U.S. has the most expensive healthcare system in the world, while at the same time, it has the worst outcomes compared to every other high-income nation.
According to a recent study done by the Commonwealth Fund, compared to other high-income countries, the U.S. has the lowest life expectancy at birth, the highest death rates for avoidable or treatable conditions,
the highest maternal and infant mortality rates, among the highest suicide rates,
the highest rate of people with multiple chronic conditions, an obesity rate that's nearly twice the average of other high-income countries.
According to a recent NPR article, 38% of Americans are putting off medical treatments, delaying their doctor's visits, dental and vision exams, and they are also not taking their medications.
Many people don't even have health insurance, or they have a really ridiculously expensive plan that costs more than $1,000 per month, but it has a really high deductible, so everything is out of pocket unless something really catastrophic happens.
Prescription drug prices are among the highest in the world, and some insurance plans do not cover certain medications, making it really difficult for people to get what they need.
And some medications aren't even available in the United States, especially if they're really cheap and therefore not profitable enough.
Thanks to inflation and high housing costs, people have to choose between basic necessities and healthcare, which is also a basic necessity.
Plus, wait times are ridiculously long. We've heard from several viewers they have to wait 6 months to see a specialist. That can really be a disaster, putting off an appointment for that long.
Unless you have a Cadillac plan with a big corporation or the government, you are probably in the same boat as the rest of us.
In fact, healthcare is the main reason we left the United States for good. I just couldn't afford healthcare or health insurance following my 2 spinal surgeries, so we just had to leave.
Luckily, there are cheaper and better alternatives outside of the US. They just might be a little bit more unconventional.
Medical tourism is a viable option for a lot of non-emergency treatments, and a lot of countries have really high-quality doctors and hospitals for a fraction of the cost.
For example, a recent USA Today article states that costs are 40 to 60% higher in the US compared to Mexico.
Our medical costs in Ecuador are substantially less. We have a private health insurance plan that covers both of us. It costs $214 per month. We have a $100 deductible and a $15 copay. A few months ago, I had a colonoscopy, an MRI, an ultrasound, 4 doctor's visits, several lab tests, and the total cost for everything was $988 after insurance covered 90% of it, and our $100 deductible and our copays. We only paid $277 out of pocket.
And there was virtually no wait time. JP was able to get his appointments the next day or within 2 days. As a matter of fact, when he went to go schedule his colonoscopy appointment, they wanted to get him in the next morning, which was less than 24 hours.
Yeah, I said I needed a little bit more time to prepare both physically and mentally for that procedure.
And we're able to communicate with our doctors with WhatsApp, which is really nice. We don't have to go through a whole bunch of scheduling people and back and forth. It's real-time communication.
Yeah, I needed to get a new lab test done. I sent a WhatsApp to my doctor. He responded with the script that I took to the lab. I got the results electronically within the same day. I forwarded them back to my doctor and he said, everything looks good. We'll see you at our next appointment. All of this took place within 1 day. And I asked him if he wanted to send me an invoice so I could pay him. And he said, don't worry about it. We'll cover that under your next office visit.
And doctors here also make house calls. Healthcare is just so much more accessible in Ecuador, and we hear stories like this in other countries too.
Check below for a link to a blog post that details all of the costs and the quality of our experience with healthcare in Ecuador.
People who live abroad often just pay out of pocket or self-insure because the costs in some countries are a tenth of what they are in the United States.
Or you can work with a company like Insured Nomads to get global health insurance. And a lot of times companies like that give you a steep discount if you exclude the United States.
Plus you can have a nice vacation. You could go and stay for a month or longer and still spend so much less.
This obviously won't work for emergencies, but for any sort of scheduled treatment, it's worth getting a price quote from some specialists in other countries.
Some countries offer a 1-year medical tourism visa, so you can save money, have an amazing experience, and take care of your health needs.
You can easily buy prescription medications over the counter in other countries, especially Mexico, and you're going to find other drugs that aren't even available in the US. Like here in Ecuador, we had a drug called Nucleo. After my spine surgeries, I had a lot of nerve damage, and so my feet had pins and needles and neuropathy, and Nucleo really helped take care of that. I was on it for 6 months. It only cost $15 per month for the prescription, so maybe that's why it's not available in the US, but we got it here and it worked great.
There is a potential danger associated with buying drugs outside of the US. They may not be regulated, they may contain different substances, lower quality substances, or they could just be counterfeit.
You can buy opioids over the counter in Mexico, which is not great if you have a drug addiction. According to a recent NPR article, some of those drugs are laced with fentanyl, and the US issued a warning to exercise caution when buying medications in Mexican pharmacies.
Medical tourism is usually safe, but you do need to do your research and take precautions.
Bottom line is the US healthcare system is just broken and nothing meaningful is being done to fix it.
You shouldn't have to die waiting for healthcare or because you can't afford it, but that is the reality for a lot of people in the US.
If you're looking for high quality, affordable healthcare, then check out this video next where we talk about 10 countries with better, cheaper healthcare than the United States.
And let us know in the comments below if you have a healthcare nightmare story.
All right, guys, leave us a like before you go, and we will see you all in our next video.
Ciao.